Good morning. Today is Thursday, December the 10th, and this is our weekly COVID-19 update briefing. Unfortunately, as of today, the parish has experienced a total of 7,062 positive cases. That's an increase of 534 since our last briefing a week ago, and the largest increase we've had in a single week. It is getting very, very serious. We've also had an increase of 5 more deaths since the last reported, bringing our total to 163. Governor Edwards recently announced that Louisiana has entered a new and dangerous third surge of the COVID-19 pandemic. The positive cases, increased hospitalizations, number of deaths, and the impact this has had on hospital capacity and the medical staffing has resulted in the state regressing to a modified phase 2 of the recovery, which is in effect from November the 25th through December the 23rd. The governor has stated that all the information we get from the White House, Corona Task Force, experts, and other experts, we're in for a couple of really bad months, really tough. Medical experts predict an increase in positive cases now that cold weather has arrived and more people are staying inside. Unfortunately, that is now occurring. The tough months are here. The governor has cautioned that we not expect reduced restrictions just prior to Christmas. It is likely that his orders will be extended through Christmas and New Year's. He's hopeful that he will not have to put more restrictions in place for the holiday season, but has not ruled it out. We are on a path to overwhelm our medical facilities and ability to staff all the positions, and we simply can't let our healthcare capability be jeopardized. The number of people hospitalized with this disease has more than doubled since the last month. The governor has conceded that strict statewide enforcement of his directives, is not feasible. He has stated that, quote, if people insist we enforce our way through this, we are doomed to failure. He urges that we will be good neighbors and voluntarily and consistently comply with the prevention and mitigation procedures and protocols. The firms of Pfizer and Moderna have announced recently that their vaccines are 95% effective, and that is tremendous in such a short period of time. Both organizations are on track to be reviewed by the Food and Drug Administration this month, and as a matter of fact, the FDA is meeting today to look at Pfizer's vaccine and consider it. As we've heard that Pfizer is a tremendous vaccine, but the unusual thing is it requires it be transported in containers that can maintain a minus 94 degrees Fahrenheit. But the capability is there. Moderna does not have the similar requirement for that level of freezing or cold temperature when being transported. A third vaccine, AstraZeneca, and one other are also in the pipeline. Determining priorities for receipt of the vaccine and the logistics of distributing them are being determined. It is likely that the first persons to receive it will be healthcare providers, hospital employees, and those who live in nursing homes or assisted living facilities. The governor expected that we will receive about 79,000 vaccines initially during the first 2 weeks of distribution. U.S. Health Secretary Azar stated Louisiana's delivery plan was one of the 4 best in the nation, which is a compliment to our people in the state, the governor, and his staff for the way they have prepared for this logistical issue. Vaccine for the general populace will probably not be available until May or June of next year. But the vaccines are being pre-positioned, and Approval by the FDA is expected maybe as early as 24 hours, but we shall wait and see. Also, the firms of Walgreens and CVC have been contracted to play a major role in the vaccination process. There is concern that when the vaccines are available to the general public, there will be a reluctance to receiving the vaccination. If so, the effectiveness of the vaccine would be minimized if large numbers refuse vaccination. If there's not a sufficient number of people receiving the vaccination, some experts indicate we may not have the herd immunity where we are protected from the disease and to stop its spread. It is hoped that the first individuals to receive the vaccination will have few ill effects. Most medical experts think there will be some short-lived unintended negative results, but not to last more than a day or two normally. Former Presidents Obama, Clinton, and Bush have all said publicly that they will be willing to take the test publicly just to help convince the general public that it's safe to take the vaccine when it becomes available. As local Dr. Philip Roseman has quoted saying, the faster we vaccinate high-risk individuals, the quicker we will see lower death rates and lower hospitalization rates. Governor Edwards has stated that he is confident it is safe and effective, but he understands that that doesn't immediately translate to somebody else, and we understand that, he says. The number of individuals who are asymptomatic is estimated to be 40 to 50%. A substantial portion of the infected people never develop symptomatic illness, but can still transmit the virus and infect others, causing illness and death. Wearing a mask remains a major issue of concern, but almost all the medical science says it does save lives. And it has been directed in Louisiana that every individual age 8 or older shall wear a face covering over the nose and the mouth when inside a commercial establishment or any other building or space open to the public, whether indoors or outdoors, and this also includes public or commercial modes of transportation. The CDC, Center for Disease Control, also now recommends that children age 2 or older wear masks. They are concerned with the spread of the virus through small gatherings now, things such as weddings, Christmas, New Year's, the holiday break from schools and colleges, where people tend to let their guard down at these events. We're just now beginning to see some of the results of Thanksgiving, and it is very negative as it was anticipated it would be. So prevention and mitigation procedures are unchanged, and as always we want to review those and remind everybody that they should be wearing a mask, wash their hands at least 20 seconds, cough into the bend of your elbow, do not touch your face, disinfect surfaces which are frequently touched such as doorknobs, rails, your computers and things like that. If you're sick, stay at home and provide the advice of your medical provider, and as always avoid crowds. Next, get the flu shot as soon as possible. The Center for Disease Control and the governor urges everyone to get this vaccination to help avoid the potential for compounding the problem of having both flu season and COVID-19 occurring at the same time. So take the vaccine when it becomes available and get your flu shot as soon as possible. A major change was announced this past week by the Center for Disease Control and the Louisiana Department of Health concerning the number of days a person should quarantine. The CDC is now allowing a quarantine time to be shortened to 10 days on day 11 if no symptoms have been reported during daily monitoring. Quarantine can also be shortened to 7 days on day 8 if the individual takes a COVID-19 test and receives a negative result. The Louisiana Department of Education has given school systems the green light to start following these relaxed quarantine rules immediately at its 1,700 schools. The existing 14-day quarantine protocol is still the so-called gold standard, which guarantees a maximum reduction of post-quarantine transmission risks. The CDC hopes these shorter quarantine periods will encourage more people to comply, and LDH is still recommending the full 14-day quarantine period for use among residents and staff of congregate living settings such as nursing homes and correctional facilities. I thank you, ladies and gentlemen, for your continuing participation in our fight against this deadly pandemic. Our next scheduled briefing will be Thursday, December 17th. This concludes our briefing. Thank you and good day.